The World Health Organization published new guidance Thursday, saying it can't rule out the possibility that the coronavirus can be transmitted through air particles in closed spaces indoors, including in gyms and restaurants. The WHO previously acknowledged that the virus may become airborne in certain environments, such as during medical procedures that generate aerosols. The new guidance recognizes some research that suggests the virus may be able to spread through particles in the air in indoor crowded spaces. It cited choir practice in restaurants or in fitness classes as possible areas of airborne transmission. In these events, short-range aerosol transmission, particularly in specific indoor locations, such as crowded and inadequately ventilated spaces over a prolonged period of time with infected persons, cannot be ruled out, the United Nations Health Agency's new guidance says. The WHO said in its guidance that while early evidence suggests the possibility of airborne transmission in such environments, spread by droplets and surfaces could also explain transmission in those cases. However, the detailed investigations of these clusters suggest that droplet and fomite transmission could also explain human-to-human transmission within these clusters, the guidance says. The WHO added that more research is needed to further investigate preliminary findings. The agency says the main mode of transmission is still believed to be through respiratory droplets. Airborne transmission of the coronavirus could occur if virus-carrying droplets generate microscopic aerosols by evaporating, the WHO said, or if normal breathing and talking results in exhaled aerosols. In theory, WHO says someone could inhale the aerosols and become infected. But it remains unknown, WHO says, if such aerosols would actually carry enough viable virus to cause infection. To date, transmission of SARS-CoV-2 by this type of aerosol route has not been demonstrated. Much more research is needed given the possible implications of such route of transmission, WHO's guidance says. WHO said it is further researching the role of different modes of spread, including by air, as well as how much virus is required to potentially infect someone and what kinds of environments create greater risk for spread. If airborne transmission proves to be a major factor in the spread of the virus, it could have wide-ranging policy consequences. Masks may prove to be even more important in reducing infections, especially in indoor environments and even in areas where physical distancing is possible. And more specialized masks designed to block microscopic particles may become more important. Specially outfitted ventilation units designed to kill the virus in circulating air could prove critical in preventing spread in indoor, congregate settings.